This is Dr. Heidi Klein. I'm going to walk you through a cataract surgery that I performed on a dog. I'm making a dorsal incision, a clear corneal incision using a 69 beaver blade. This incision is about 4 millimeters long and about 75% of the corneal depth. I'm going to finish this incision using an angled blade. This is going to create a two-planed incision, which will facilitate watertight closure when we're ready to close the incision. A viscoelastic device called Hylartin V is now instilled into the anterior chamber. This will maintain the anterior chamber and create a space within which we can work. It also protects some of the intraocular structures during cataract surgery. A 22 gauge needle is used to make a capsulotomy, which is just a small tear in the anterior lens capsule. And then Utrata forceps are used to make a continuous curvilinear capsulorhexis, which is basically a hole in the anterior lens capsule, which is a space through which we can remove the cataract. You can see the circular portion of the anterior lens capsule that was removed. Phacoemulsification is now performed using ultrasound energy. I'm able to break up and suck out the cataract. Any remaining lens, like the cortex, is removed using irrigation aspiration, as shown there. The lens is then injected into the lens capsule. This is a foldable acrylic lens, so it's slowly injected into that lens capsule behind the anterior lens capsule, and then positioned using a lens manipulator. So it's centered and positioned within that capsular bag. The corneal incision is then closed using 9/0 Vicryl in a simple continuous pattern. The light shield present on the cornea protects the retina from the strong light of the microscope and prevents any retinal burns. Before closure of the eye, the viscoelastic device is aspirated from the anterior chamber. Now that this patient has had the cataract removed and the false lens placed, she can see well.